All right, today we're cracking open the case file on a medical mystery that's been sort of hiding in plain sight since 1938. We're talking about a condition that messes with our most vital pathways, our arteries. And honestly, for a lot of doctors, it's still a huge puzzle. The condition? Fibromuscular dysplasia. So let me ask you this. What if the highways carrying blood all through your body, instead of being smooth and clear, looked more like a delicate string of beads? Just picture that for a second. That single visual, well, that's the biggest clue in our entire investigation. It's the hallmark of this whole medical mystery. Okay, so what exactly is fibromuscular dysplasia, or FMD for short? Well, it's a disease where the cells in your artery walls just start to grow abnormally, and that can cause all sorts of problems. It can make the arteries get too narrow, bulge out into an aneurysm, or even tear. But here's the really crucial part, what it isn't. This is not the typical plaque buildup you hear about with heart disease, and it's not caused by inflammation. That puts FMD in a whole different league. So let's officially open up the case file on FDMD. It's time to start piecing together the clues on this really puzzling condition. This quote right here, it gets right to the heart of the mystery. I know, it sounds super technical, so let's break it down. Idiopathic is just a fancy way of saying we have no idea what causes it. Nonatheromatous and noninflammatory, well, that just confirms it's not plaque or inflammation. So, right from the get-go, we're dealing with a disease where the fundamental why is still a total puzzle. So, what are the facts of the case? What do we know for sure? Well, we know FMD likes to target the body's medium-sized arteries. The most common crime scenes, if you will, are the renal arteries heading to the kidneys and the carotid arteries in your neck that feed the brain. But while those are the hotspots, this thing can pop up almost anywhere. And here's another huge clue. Up to 10% of cases run in families, which definitely suggests there's some kind of genetic link going on. Okay, so we know where FMD tends to strike. But, the next big question for any investigator is, who? Let's build a profile of the person who's most likely to be affected by this. This statistic is, honestly, it's just incredible. Over 90% of all FMD cases are in women. Let that sink in. That's more than 9 out of every 10 people diagnosed. Now, we don't know the exact reason why, but a lot of researchers think female hormones might be playing a role. And it typically shows up right in a person's prime, somewhere between the ages of 20 and 60. And then you've got this major risk factor, smoking. Just look at this chart. The data shows that 37% of patients with FMD were smokers. That's more than double the rate for women in the US in general. The exact why is still being figured out, but the link between smoking and having more severe FMD is, well, it's pretty much undeniable. Okay, so we've got our condition and a profile of who it affects, but how does this hidden disease actually, make itself known? Let's take a look at the clues, the signs and symptoms that FMD leaves behind. This is fascinating. Where those beads are located totally determines the symptoms. So if FMD is in the arteries going to your kidneys, it can cause this really stubborn high blood pressure that just doesn't respond to treatment. A doctor might even hear a whooshing sound in the belly, which is called a bruit. But if it's in the arteries in your neck, the clues are completely different. You're looking at severe headaches, a whooshing sound in your ears that beats in time with your heart, dizziness, or even something as serious as a mini stroke or a full-blown stroke. And the list of potential clues doesn't stop there. FMD is also linked to some really serious events, like SCA-CD, that's a spontaneous tear in a heart artery. Or aneurysms, those dangerous bulges, and dissections, which are actual tears in the artery wall. Some less common signs can even be things like neck pain or weird changes in your pupils. Okay, we've gathered all the clues, we've profiled our patient. Now, it's time to find the smoking gun, that one piece of definitive proof that confirms the diagnosis. So the first step is often a CTA or an MRA scan. And these are really powerful tools, but they do have a catch. They can sometimes miss that classic string of beads pattern if it's hiding out in the smaller branch arteries. So to be absolutely sure, our doctors, they need to get a more direct look. And this is the gold standard. I know, it's a mouthful. Intra-arterial digital subtraction angiography. It sounds super complex, but what it does is amazing. It basically means a tiny catheter is guided right into the artery, a dye is injected, and doctors get to watch a live-action, high-def movie of your blood flow. It's hands down the most accurate way to nail the diagnosis. And this is the aha moment, the big reveal. The angiogram lights up, and there it is, clear as day, the classic string of beads. You can literally see the spots where the artery wall is thin, creating a bead, right next to thickened ridges that make up the string. It's an unmistakable signature. It's like FMD's fingerprint. So the diagnosis is confirmed. The case is officially cracked. But of course, for the patient, this is really where the journey begins. Now the whole focus shifts to managing this thing for the long haul. The treatment strategy is basically a three-pronged attack. Goal number 1, get that blood pressure under control because it's often dangerously high. Goal number 2, prevent the really scary stuff like an aneurysm bursting or stroke. And goal 3, relieve the symptoms that are making life difficult. So what's in the doctor's toolkit for this? Well, there are a few options. Medications can help manage blood pressure, but for a lot of people, especially if high blood pressure is coming from blocked kidney arteries, the go-to treatment is a balloon angioplasty. It sounds pretty wild, but a tiny balloon is threaded right into the artery and inflated to push open those narrow spots. Open surgery, that's usually just for the most complicated cases. And the results of that angioplasty can be absolutely dramatic. The balloon physically breaks up those fibrous bands and stretches the artery wall back out. It essentially smooths out that string of beads highway, creating a clear path for blood to start flowing normally again. And that kind of brings us to our final thought here. For decades, FMD was thought to be super rare. But as doctors have gotten better at spotting it, we're realizing it's way more common than anyone ever thought. So it really makes you wonder, right? How many other people out there with unexplained high blood pressure or headaches or that whooshing in their ears might have this hidden signature in their arteries? How many other medical mysteries are just waiting for us to look for the string of beads?